Making today's major announcement to ditch hotel and home quarantine in New South Wales was the Premier and his Liberal Party Deputy, the Minister for Western Sydney, Stuart Ayres. He joins us now from his electorate in Penrith. Minister, welcome.
Good evening, Chris. Good to be with you.
Yeah, good to have you. This is a big, bold and progressive roadmap. Was there any opposition from within the crisis cabinet, firstly? And secondly, was the PM appraised of where you were going with this?
So I won't go into the details of a cabinet discussion. Suffice to say that I think people should be aware that we're making this decision with the full support of our public health team. We wanted to make sure that we were taking the public health advice and doing this in an appropriate fashion.
Yep.
And Chris, this is really governed by the really rapid take-up of vaccines in New South Wales. We've made a decision today that means that when New South Wales will be around the 90% fully vaccinated rate, maybe even past that, that we won't undertake quarantine. It doesn't need to be in a hotel and it doesn't need to be in a home. We can't really see why you would ask a fully vaccinated person travelling from overseas to quarantine when we're largely allowing every fully vaccinated person in the state of New South Wales to move freely around the state. The application of those resources to support that quarantine would be far better off in our hospitals and out with our police force on the ground, helping the community transition to a more open economy in a safe way.
But the problem with ditching home quarantine is that it is part of the national plan, which is why ministers in Queensland and Victoria were taken aback today because they didn't understand that home quarantine wasn't part of the deal.
So, Chris, we're still sticking with the national plan. We're just moving a lot faster than what the other states are because of our vaccination rates. I completely understand why some states would want to know how this will impact their state. If you're a fully vaccinated person coming into Australia through Sydney and you're transiting to another state, we'll make sure that those people understand what the requirements are in those states. There's communications that are available in the airport, on airlines, to be able to say that if you are transiting, you'll be moving into another jurisdiction that may have a different quarantine setting to New South Wales, and you must familiarise yourself with that. It's no different to people entering Australia and undertaking any of those normal biosecurity protocols.
All right.
But there's no reason for us to go into home quarantine for no particular reason. If we've got 90% fully vaccinated, we don't need those people staying at home, requiring us to monitor them in their own home when fully vaccinated people, and over 90% of the New South Wales population, can move freely around the state.
So when they arrive at the airport and return home, will they be getting a rapid antigen test? Will there be any testing required when they arrive?
So they'll be required to undertake a pre-departure PCR test and test negative.
And that's it?
They'll also have to have their vaccination status verified by the Commonwealth Government, and we will ask them to undertake a PCR test within 3 to 5 days of them arriving.
Right. Okay.
We won't ask them to do a PCR test at the airport. We actually think the logistics and operation of that in the airport setting, particularly as more and more people come on board, we don't think that's the most efficient way. We also think that the efficacy and accuracy of those rapid antigen tests at the point of the airport are probably not that valuable for us. We would much rather take a PCR test a few days later, and if we have to ask that person to isolate, we can do so. But bear in mind, we're talking about fully vaccinated people coming into a highly vaccinated population. That is completely in line with Phase D and Phase C and Phase D of the national plan.
And as part of this plan this morning, you wanted from November 1 to see tourists come to Australia. The PM corrected this afternoon. Are you happy that he didn't want tourism to restart at the same time?
No, I think this is a really interesting point, Chris, that I want to correct. I think a lot of us have forgotten what the responsibilities of state governments are and what the responsibilities of the Commonwealth Government is. I remember very clearly a former Prime Minister saying that the Commonwealth Government will determine who comes to Australia and the circumstances in which they come, and that hasn't changed. What we've done today is merely announce that we're not going to delineate based on a person's citizenship or the reason for why they're coming to New South Wales. We're merely only going to determine whether they need to do quarantine or not based on their vaccination status. The Commonwealth Government will always determine who they grant a visa to, whether they support an international student coming here, a agricultural worker, a skilled worker, a tourist, a permanent resident returning home. All of those requirements still sit with the Commonwealth. We're not changing that. We're merely saying to our citizens here in New South Wales and also saying to the world that if you're coming into our state from the 1st of November and you're fully vaccinated, you will not have to quarantine.
So it's a given that as soon as the feds decide students are coming in, tourists are coming in, you'll do it seconds later.
Well, we've already made that decision, Chris. That's what we've said today, where it's not our job to grant visas. We don't have that jurisdiction control. That belongs with the Commonwealth. That is appropriate. That's why we have a national government. I think we've got to sometimes remind ourselves that we do still have a constitution that functions incredibly well. We may have strained the Federation over the last 12 months as states have all tried to look after their citizens. But this idea of the nation determining our migration patterns hasn't changed here. All we're saying to people, when you're making your decision about whether you want to travel to Australia, for whatever purpose that might be, returning home because you haven't been able to get access to a flight because of our low caps, if you are considering moving to Australia to work, if you're considering a holiday here, you're choosing to come to New South Wales and you can get access to a visa via the Commonwealth, you won't have to quarantine in New South Wales if you're fully vaccinated.
Do you expect other states and territories to follow your lead on this? Because I guess if they don't, we then have this hodgepodge of restrictions and part quarantine, which will differ from border to border and be a complete and utter mess.
Well, I think we have to recognise, Chris, that vaccination rates are different from state to state. We've been through the immense pain that the Delta variant has brought on New South Wales, 16 weeks of lockdown of various stages in Sydney and parts of regional New South Wales. That has also meant that New South Wales has rapidly taken up the vaccine. That's a fantastic outcome. It's giving government great confidence to make decisions about reopening our economy. We're doing that consistent with the advice from our public health team. I don't think we should wait for every other state to get to the same point as we are. We'll be well into the 90s, if not closer to 100%, before other states get to that point. I'm very comfortable with states maintaining high levels of restrictions and quarantine while they've got lower rates of vaccination. But I think there will be very few states around Australia that will be asking people to undertake quarantine when their populations are more than 90% double dose vaccinated.
Yep, and that is the point. I appreciate your time this evening. Thank you very much for that.
Not a problem, Chris, anytime.